Assalamu alaikum and welcome to the Dr. UUT channel. In this video, we will talk about the action potential in the myocardial cell or in the cardiac cell. This video is in English and available in Urdu. So, starting the myocardial cell or the action potential in the myocardial cell, the resting membrane potential of the cardiac cell is -90, and action potential is studied in the four phases: phase 0, phase 1, phase 2, and phase 3. And phase 4, 1, 2, 3, 4, 5. 5 steps and one phase 0, phase 1, phase 2, phase 3, and phase 4. 4 phases and in the 5 steps. Step number 1 is the stimulus reaches the cardiac cell. In the phase 0, there will be the opening of fast sodium channel, which will cause the depolarization, and the cell will shoot up towards positive 20. And what happens here, they will lose their strength, means the sodium channel will close. And in the second step, or you can say in the phase 1, there will be the transient potassium channel which will open, due to which what will happen, a slight or transient depolarization is going to happen. Why? Because the channel is transient, means it is short-lived. And in the meanwhile, as the transient potassium channel close, so they cause a little bit depolarization, repolarization. Here was a depolarization, here is a repolarization. And what happens next is, after the transient potassium ion channel they close, then in phase 3, or you can say in the step 3 in phase 2, step number 3, phase number 2, there will be the opening of slow calcium channel. Calcium channel are slow. As we know that positive is supposed to move from outside to inside. And if the positive ions move inside the cell, so it will again undergo the process of depolarization, so it has to shoot again, but not. It is forming a plateau. The reason is that it is slow calcium channel. Here, the slow calcium channels are getting open. Due to this, and there are also some potassium leaky channels available. Due to these two, the slow calcium will not shoot up anymore, or any fast or any up. And due to potassium channels, they will again inhibit or stop the depolarization, or will try to stop the depolarization. So like this, they are also short-lived. They will form a plateau here. And in the fourth step, you can say in the third phase, what will happen? The slow calcium channels will close and the fast potassium channel will open in the fourth step, or you can say in the third phase. So here, fast potassium channels will open. Due to their opening, the cell will undergo the repolarization, full repolarization. Here was transient, here is full. And it will reach the fourth phase, means up to resting membrane. And in the fifth step, you can say, or in the fourth phase, there will be the opening of the activation of sodium potassium pump. So which will then regulate the concentration of the ions. Outside it will make positive, and inside it will make negative. So it will become negative due to these sodium and potassium pumps. And they're helping to maintain the resting membrane potential. So like this, the phase 0, phase 1, phase 2, phase 3, and phase 4 are functional. And bringing the lecture into a concise way and a comprehensive way, phase 0 will be, here will be a kind of depolarization due to sodium channels, and transient repolarization will be due to the transient potassium channels. And the plateau phase will be due to the short-lived or slow calcium channels along with the potassium channels. And the strong or steep downshoot will be due to, or you can say repolarization will be due to the potassium channels, the fast potassium channels. And again, the resting membrane, which is being brought, that is due to the sodium potassium pump. So that's a little bit about the action potential in the myocardial cell or the cardiac cell. Thank you for watching.